This is a Global News special presentation.
Welcome to a Global News special presentation. It is our latest COVID-19 town hall, navigating the coronavirus crisis.
For the next 30 minutes, we'll be putting your questions to Premier John Horgan and BC's Provincial Health Officer, Dr. Bonnie Henry, who are joining us live from outside the chamber in the BC Legislative Building. Thanks to you both for joining us. We got a number of questions submitted by viewers, and we're on Facebook Live as well as we move into now the third month of the novel coronavirus pandemic.
And hopefully just a couple of days away from phase 2 and a slight relaxation of the restrictions. All right, let's get to our questions. And the first question, very pressing for all hockey fans across the province. We led the news hour with it tonight, and let's ask Premier Horgan about this. Premier, you've been in talks with NHL Commissioner Gary Bettman today, not that long ago. So does that mean Vancouver is being considered as a hub city to host multiple teams, possibly the playoffs? And would taxpayers be on the hook for any of this?
That's a lot of questions, Sophie, and it's great to be here tonight with Dr. Henry. And I think Dr. Henry shares my enthusiasm for hockey. I haven't decided whether she's a Canuck fan yet, but we'll work on that. It was a good, productive discussion with Gary Bettman, the commissioner of the NHL. Bill Daly, his assistant, joined the call. I was joined by our minister, Lisa Baer, responsible for sport in BC. She's been coordinating with the Canucks on the plans to use Rogers Arena and any other facilities in the Lower Mainland or even perhaps across the province. Mr. Bettman and I had a candid conversation. Obviously, there are a whole variety of factors at play here. First and foremost, of course, is the well-being of the players and the safety of the community where the NHL would operate. The NHL has a good track record in Vancouver, of course, the 50th year of the Canuck franchise this year. What a great way to celebrate that 50 years and to bring hockey back to Canada and North America by coming to BC. Dr. Henry and I talked about this with Minister Dix at some length before we made the overture to the NHL, and Dr. Henry agreed that if we ensured physical distancing, in other words, no fans in the seats, that these were televised games, we could work with players on their safety with respect to full shields and a range of other equipment issues, and that it would be based on a good solid plan from the NHLPA and the league, we could begin hockey here in British Columbia. Mr. Bettman didn't give us a time frame at all. He was encouraged that the province was supporting the initiative that the Canucks started, quite frankly, with the league. And I'm hopeful that in the weeks ahead, Mr. Bettman will have more to say and we'll be able to review a solid plan that will protect the community and protect the players.
Ted from North Vancouver asks a question, Premier, that kind of ties into this, and it's about cross-border traffic. Will you resist federal pressure to reopen the Canada-U.S. border, which assumably would be a requirement of getting the NHL started up here?
Well, we did discuss the isolation, the 14-day isolation program that we have here in British Columbia. Mr. Bettman was aware of that. I said we had no intention of waiving that. Now, if we're a month or 2 months away from a startup, then we can certainly revisit that. But we have no plans to change that. I've made that clear to the Prime Minister. Other premiers have supported me, particularly Ontario and Quebec. We believe that the border restrictions are appropriate to protect our communities. You'll remember when this began, Dr. Henry and Minister Dix and I announced the pandemic response plan of the government way back on March 5th. One of the biggest challenges we saw was directly south of us in Washington State. That remains to this day. So it's my view, and supported by Dr. Henry and her team, that the border restrictions are appropriate. We went to the extreme lengths of stepping into federal jurisdiction to put provincial employees at YVR and at our border crossings to make sure that everyone who came into Canada from British Columbians returning home understood that they needed to have a self-isolation plan. That's been working very effectively, and we'd have no plans to change that in the immediate term.
Okay, so from cross-border travel to travel within BC, with the weather getting better, many are wondering about what they can do this summer. Can they travel within BC? Terry from the Okanagan says that's a tourist hotspot. He wants to know if there's a plan to keep tourists away and keep people there safe. And I guess that's a question that a lot of people from other parts of BC would be wondering as well.
Absolutely, Sophie. And I'm, as you know, you're an islander as well, way back. People want to come to Vancouver Island on a long weekend. They want to enjoy the spectacular opportunities we have here in British Columbia. But as Dr. Henry and I have said, every part of British Columbia is beautiful. Stay home, enjoy where you live, restrict your travel to essential travel in the immediate term. We will be reopening provincial parks for day use on Thursday of this week. And again, we expect British Columbians to visit parks in their community or in their area, not travel by ferry or not travel across the province to visit one of your favorite spots. I was on radio this morning in Kelowna, where a lot of Albertans will come, of course. Many are property owners there. Jason Kenney, the Premier of Alberta, and I have had the same message: stay home. Albertans, of course, and Canadians have the right to move. Free mobility in this country is very important. But at this time, it's appropriate that people stay closer to home. Let's not put a strain on our resources. Let's continue to bend the curve. We've had extraordinary success here in British Columbia because of the efforts of all British Columbians and those who have had to come here for essential business. Let's keep that focus on. We're not lifting restrictions until after the long weekend. People should stay close to where they live as much as possible.
So, Dr. Henry, I think this probably covers off Calvin from Port Coquitlam. He says he's got a cabin booked in Vernon for the last week of May, and he asks, can I go or should I cancel? How far can we travel? It sounds like your position would be don't travel that far.
Yeah, that's in the short term. And, you know, we'll be looking into June, July, and August, where if things continue on the right track, we need to think about, you know, how can we support our businesses in those tourist areas, but do it local. You know, we've been talking about this is a summer where BC, people in BC enjoy BC. And so, yes, I do think we need to think about later on in the summer, if things keep going the way they're going, then, yeah, let's look at how we can go to our second homes or go to some of the tourist areas and experience it here in British Columbia, but do it in a way that is respectful and mindful of what is in place in those places as well. But it's also important, many communities rely on that type of tourism to get us through economically. So I think we have to find that balance. And later in the summer, I hope we can enjoy the rest of British Columbia.
Okay.
And I would add, Chris, that part of our restart plan is to focus on Destination BC and encouraging people later in the summer to visit other parts of British Columbia. But we have work to do together, as Dr. Henry has clearly stated. But we do have a marketing plan to make sure that those tourist businesses in the far reaches of British Columbia and even around the corner have the marketing dollars and the confidence of the traveling public to come here locally. Of course, within BC, international travel is a distance away, I think, at this point. But we want to make sure that those tourist destinations still have an opportunity to make a few bucks this summer. But as Dr. Henry says, much later than now.
Yeah,
gotcha.
Not right at the moment. All right, Premier Horgan, Dr. Henry, we have a video question for you now.
Hello, my name is Sam.
I'm Katie.
And we pastor a church here locally in Powell River, BC.
We just have a quick question for you. Our understanding is that in phase 2, we can begin gathering as small groups of people, under 50 people, and that we would still maintain a 6-foot social distance. And so our question is, do you have any more specific expectations for churches during this next season? We don't want to do things wrong, and so we just have that question for you.
Yeah, we want to do things well and keep this community safe. Thank you very much for answering our question.
Lots of people of faith wondering that question as well.
Can you answer that one quickly?
You know, I think that's it. Yeah, sure. The restriction is maximum 50, but it depends on your facility. So if you have a very small church, then it might be much less than that to be able to keep that important distancing and the provisions that people have been putting in place. So I've been really impressed. We've met a number of times, the Premier and Minister Dixon and I, with faith leaders across the province, and people need them right now, and they're doing an amazing job. We need to continue to have that hybrid of being able to reach people, particularly people who are older, who might be more at risk of this disease. And then, yes, let's look to the future in the next phase of being able to have people in smaller numbers, and we may need to have more frequent services so that you can accommodate people in smaller numbers to fit your facility, but maximum 50 for sure.
Okay.
All right, we're going to take a short break. Thanks very much to the Premier and to Dr. Bonnie Henry. More of your questions for them on the other side of this break. Stay tuned.
Welcome back to our virtual town hall navigating the coronavirus crisis. We are asking your questions to Premier John Horgan and BC's Chief Medical Health Officer, Dr. Bonnie Henry.
Standing by right now to get the next one. Thanks to everybody who sent in questions online and sent in videos as well. We've got another one for you. It's short and sweet. We'll start it off here with Alessandro.
Premier Horgan, I would like to know when ICBC will resume road tests.
I know a lot of young people who want to get their licenses.
Very concerned about it. What do you say, Premier?
Absolutely. Again, getting your driver's license is one of those rites of passage as a young person, as is a graduation ceremony coming out of high school. And regrettably, the class of 2020 won't be having the types of celebrations we had in our day. The good news is on the graduation side, every year there's a reunion and you can have a good party in the future. But for now, we need to stay apart. When it comes to ICBC and road testing, there is work being done to try and find a safe way to social distance and physical distance within an automobile with a passenger seat and a driver's seat. We're looking at plexiglass options. Already ICBC is expanding appointment-only written tests, and I think we can get into the driving tests in the future, but they need to be safe. We need to make sure that we're adhering to all of the guidelines that Dr. Henry's put in place, and I think ICBC is working on a plan. David Eby understands the importance to young people to get that driver's license and get out on the road and drive safely.
No timeline, though, at this point.
No, not at this point, Chris. Again, our restart is slow and focused rather than the flicking of a switch and let's go. This is one of the issues that's very much at the top of mind because it is, quite frankly, one of the services government traditionally provides. So we have an obligation, I believe, to lead the private sector to demonstrate that we can continue to conduct our business in a safe manner, protecting the public, protecting workers. If we're expecting the private sector to do that, the government should be doing that as well.
All right, we've had many questions about the restart and how we'll be rolling out the reopening of businesses. We've got one from Kelsey who asks, how can we open hair salons by mid-May or May 19th if there is a mandated closure until May 30th? WorkSafe has no answers for us, says Kelsey. Perhaps that's one for Dr. Henry, since Dr. Henry issued the order.
It is my order, yeah. So I'm looking at that, and what we'll be doing in the coming days is revising the order to allow for opening of salons, personal service establishment in a graded way over the coming weeks, provided they meet the standards or the guidelines that we're coming out with. And as we've talked about, there's a lot of work going on right now between WorkSafe, between Public Health, who provides infection control advice for barbers and salons and other personal service establishments. So I don't expect everybody is going to be open on the 19th. Mm-hmm. What I expect is that the work will be ongoing over the coming days to allow operators to know what they need to do and how they're able to do it for their own shop or salon, and to make sure their own employees are safe as well as their customers.
Related to this, Dr. Henry, is a question from Justin. He says he owns a small business. He's asked his staff to begin on May 15th, but his employees are scared to come back. And he asks, is it mandatory for staff to return to work? What position is he in at this moment?
So it's not mandatory for any business to start up again. I think what we've said is, there are guidances and there are guidelines that we need to follow, and that's what's going to keep our employees safe, keep our businesses going, keep our customers safe. So you have to be able to meet those, and part of the accountability to meeting those is publishing a plan. So whether you post it on your window or whether you post it on the internet, so that everybody knows what you're doing. So nobody is being forced to go back to work. and I think that is an important thing for people who own businesses to consider, depending on what your business is. One is the risk that employees have. So if they are older, if they're people who are going through cancer treatments, have underlying illnesses, it might not be appropriate for them to come back into the workplace yet. So that's the thing that everybody has to figure out on their own. So I do expect that there'll be gradual openings for different businesses depending on the customers they serve and their employees. So I know it's challenging and we're all working through it. We've never had to do something like this before. So we will be doing the best we can through public health and through WorkSafe to support people in making those appropriate decisions. And it's going to take some time, as it did when we put the orders in place. It's going to take some time to figure everything out for every individual, and we're committed to working with people to figure those things out to make sure it's safe for everybody in the coming weeks.
And as you've said many times, if you feel sick, don't go to work. Don't go to work. Stay home.
That is so important.
All right. A question from Lana, and I know that there have been discussions with the restaurant industry, but she wants to know, how can servers stay 2 meters away from customers while they're putting food and drinks on a table? Fair question.
Yeah, you know, it's not staying 2 feet away the entire time, and there's ways that we can do it that make it safer than others. So it's a matter of how much time you're spending in close contact. So making sure that you put the food down. So basically, we can work that one out. And it's a matter of not standing around that close and chatting, because that's where you have the concerns. And making sure we have the physical barriers, the ventilation, all those other things in place that make a short encounter less risky.
And this is a great example. Just if I could, Chris, the restaurant sector is a great example of the BC Restaurant Association working on plans for restart for the past number of weeks, because they know and understand that if people are going to come into their establishments, they need to have confidence that they're going to be safe. And if people are going to work in those establishments, they need that same level of confidence. I used to wait on tables. I've worked in the sector, but I've never run a restaurant. We need to leave that up to the business owners to figure out the best way for their business to be a success, and that involves making sure your workers are safe, making sure your customers are safe. The best people to do that are the owners, with guidance from the Public Health Office and WorkSafe.
All right. Thank you, Premier.
We will be right back after a short break. We'll talk about what happens if infections start to spike again.
The final segment now in our virtual town hall with Premier John Horgan and Provincial Health Officer Dr. Bonnie Henry answering a final question about the coronavirus crisis.
We have so many questions for you guys, but a lot of people were asking us this. Hannah put it best. She says, the majority of British Columbians have worked hard to flatten the curve. So what measures will be in place to ensure people who are coming from outside of BC won't undo all this hard work we've done and cause a resurgence of cases? Dr. Henry, start with you.
Actually, I'm going to let them.
Well, okay. I'll start with that on the international travel. And Hannah speaks for, I think, the vast majority of British Columbians. We've all worked hard to get here. Let's not let someone else come here and throw it all away. That's why we insisted on the federal government closing our international borders so that we could ensure that people coming from away didn't bring the virus. On the interprovincial travel, Dr. Henry will take that one.
It's the same, we still have this virus in our community. So one of the things that I'm making sure of and that we're working on is that we have our public health workforce out there. So we are still finding people, we're testing people, we can catch people early, and we need to continue to do that and make sure that we stop those chains of transmission. So that's what we're focusing on in the coming weeks and months as well.
Just very quickly, if there is a sudden increase or a marked increase in numbers, could we go back to phase 1 again?
No, that's the whole plan, and that's why we're doing it slowly and cautiously and putting in place these things that we know will protect people, because there is no going back in my mind. We need to manage through this, and then, come the fall, we'll do we'll know more by then too. And if we start to see increase in cases during respiratory season, we'll have a plan for being able to manage that as well. But right now, we need to find ourselves, opening up slowly and cautiously and continuing doing what we've been doing, which is, supporting each other and doing this together.
Real quick, we're often encouraged by the numbers we see, and to see a 7 today in the number of new infections was important. How did you guys feel when you saw that? Are you taking as much out of it as maybe the rest of us are?
Well, I know that Dr. Henry is looking at this every day from the early in the morning to late at night. For me, when I get my daily briefing, when I saw single digits for the third time in the past 6 days, that gave me confidence that the people of British Columbia are in this together. We're all working to make sure we're well and safe, and eternal gratitude to Dr. Henry and her team to keep those numbers down. That's a testament to all of us here in BC as well.
For sure.
I absolutely agree. I will say there's still several hundred people who are recovering from this virus, and that we know it's still in our community in low levels. So we're doing the right things. We need to keep it up.
All right. Thank you both, Dr. Bonnie Henry and Premier John Horgan. We really appreciate the time you took from your busy schedules to do this.
Once again, to you both, many of the people who sent in questions also took the time to say they're so impressed by how BC leaders have been handling this crisis by putting the needs of people over partisan politics. That goes to the health minister as well. And as Adrian Dix keeps pointing out, the health critic for the Greens and the Liberals. And it's nice to see everyone working together.
Absolutely. And thanks to all our viewers who submitted questions for us tonight. We really appreciate it, and let's hope we can hold another one of these very soon. Thanks for watching, everyone. Have a good night.
Good night.
This has been a special presentation from Global News.